My name is Sean McLean. I am an assistant professor of surgery here at the University of North Carolina. Once your child is born, the child is then initially assessed by the neonatologist. We then go over to the neonatal intensive care unit and we'll take a look at your child to try to determine how large the abdominal wall defect actually is. After a few days in the neonatal intensive care unit, we will then go ahead and plan your child's surgery. The first step is to make sure that there are no life-threatening abnormalities in the heart. And once we know that your child is stable, we can then take them to the operating room within a 3 to 4 day period after they've been born. If your child has a small defect, we can then typically close the defect with the child's own muscle tissue. And this is called a primary abdominal wall defect repair. So in cases where your child has a large defect that doesn't fit the criteria of a giant omphalocele, we can still repair the abdominal wall defect in the early neonatal period. Oftentimes, however, that will involve using artificial material or a biodegradable mesh to help with the repair. A giant omphalocele occurs when your child has a defect that's so large that it includes the liver in the omphalocele sac. In those cases, it often requires that we repair your child's abdominal wall defect in a staged fashion. When we choose to do this approach, it can often take many months before we get to the last stage of repair of closing the abdominal wall defect with your child's own muscle tissue. In those cases, we do something called paint and wait, where we help the omphalocele sac to scar with medications. Once the omphalocele sac scars in place and it toughens up, it can then support the materials within its own sac. We then can use either regular dressing materials to just watch it, or we can help the omphalocele sac contents to compress into the abdomen by using something as simple as an ACE wrap. With the ACE wrap, we do have the ability to apply compression to the omphalocele sac contents. And as time progresses and as your child grows, the contents of the omphalocele sac will reduce back into the abdominal cavity. Once that's done, we are then ready to close the abdominal wall defect. And that typically takes place when your child is around 6 months of age to as late as 1 year of age. If your child requires a delayed form of repair, once your child is stable from the standpoint of being able to eat enough food and to maintain their own body temperature, and provided that their other systems are stable, your child can go home. You can actually apply the ACE wrap compressive therapy to your child while you're at home. After 6 months or so, we'll then assess your child to see if they're ready for their abdominal wall defect to be repaired. Provided that your child does not have other congenital anomalies, your child can have a lifestyle similar to other children.
She's a very happy girl, and we're pleased with the way that she's growing and the care that she's gotten so far. We're looking forward to her surgeries in the future and getting it 100% corrected.